So the Achilles tendon, depending on the severity of the rupture, it can heal in what we call by secondary intention or secondarily. The recommendation, the standard of care in the United States and in Europe, if the patient is healthy, active, and ambulatory, or any of the above, the recommendation is surgical repair. And the reason for that is a lot of data and a lot of studies. I mean, you look at American Journal of Orthopedics, foot and ankle surgery, sports medicine. The re-rupture rate in those tendons that are allowed to heal secondarily sits between 30 and 40%, which is way too high for any patient that I want to treat. And so if to restore functional ambulation, you surgically repair it. The few times that I don't surgically repair it is it's a low-grade rupture, and it's a patient that's a very sick individual, multiple comorbidities, advanced heart disease, advanced kidney disease, that just would be a poor healer in general, and then it's safer not to do the surgery than do it. And so it's a rare occasion, but it can happen, but we wouldn't recommend it typically.